Hello, everyone. My name is Stephen Walt. I'm the CEO of Veritas. We're really excited today to launch our new webinar series around substance abuse and burnout in the nursing community. This webinar series is brought to you by the New York State Nurses Association SPAN program, as well as Veritas. COVID-19 pandemic has made a serious problem significantly worse. Nurses are experiencing unprecedented levels of stress, trauma, burnout, and substance abuse. The purpose of this webinar series is to empower nurse leaders by providing them with the education and tools that are so critically needed in this moment in time to lead. As the vaccine is being administered throughout the country, and we all begin to envision what a post-COVID world might look like, it is so important that we continue the conversation around how the pandemic has affected the mental health of our healthcare workers. In addition, this pandemic has brought about a significant amount of changes to the evaluation, treatment, and monitoring of nurses with substance use disorders, including the unprecedented use of telehealth to deliver these services. It's so important that we analyze these changes to determine how effective they were, to see what type of role they'll play in the future. So we're excited today to have you here, so thank you for participating. First, we'd like to meet our hosts, our sponsors, and our incredible panelists. I am so excited today to introduce these panelists. I can't imagine having a better group of nurse leaders today to kick off this webinar series. So thank you. Our first host is Veritas. Veritas is a virtual treatment center for licensed medical professionals with substance use disorders. They offer a telehealth intensive outpatient program exclusively for physicians and nurses, as well as they offer recovery coaching for healthcare professionals. Veritas was founded by Freedom Institute, a New York City independent, nonprofit substance abuse treatment center founded in 1976. Alex Dayton is the Chief Clinical Officer of Veritas. He was instrumental in designing this program to try to meet the needs of physicians and nurses today, where they can receive a high quality outpatient virtual treatment experience. For those of you on this call who'd like to reach out to learn more about Veritas, please feel free to contact Alex. Our next host is the New York State Nurses Association SPAN program. New York State Nurses Association statewide peer assistance for nurses SPAN is a confidential education, support, and advocacy program for all nurses licensed in New York State, anywhere on the continuum from substance use to substance dependence. It is also a resource for schools, organizations, and healthcare facilities concerned about the effects of alcoholism and drug addiction on the nurse workforce. You'll see their website and telephone number. I'll wait for a second if anybody there wants to take down that information. Our sponsors of today's events are Creative Healthcare Management, which is an international consulting company specializing in professional practice, leadership training, staff empowerment, relationship-based care, and workplace culture transformation. And your other sponsor is Alina Lodge. For over 60 years, Alina Lodge has been at the forefront of addiction treatment, and today is widely considered to be among the top residential addiction treatment programs in the United States. I also like to send a special thanks to Aaron Garner. Aaron was instrumental in helping to design this program, as well as the marketing of this event. So thank you, Aaron, for all of your hard work. Our first panelist is Marie Manthe. Marie is President Emeritus of Creative Healthcare Management, an international consulting company specializing in professional practice, leadership training, staff empowerment, relationship-based care, and workplace culture transformation. She has conducted seminars on a wide variety of management and leadership topics for more than 1 million people. Among her academic positions, she was an associate professor at the University of Connecticut, an associate clinical professor at Yale University School of Nursing. Marie also served as assistant professor the University of Minnesota School of Public Health, and is currently adjunct faculty at the University of Minnesota School of Nursing. Marie Manthe received the first honorary doctorate degree awarded by the University of Minnesota School of Nursing in June 1999. 6 years ago, Marie was one of the founders of the Nursing Peer Support Network, a freestanding nonprofit organization providing peer support opportunities and also nursing education programs around substance use disorder in the nursing workplace. So grateful to have you here today, Marie. Our next panelist is Madeline Nagel. Dr. Nagel is nationally and internationally known for mental health and substance abuse education, research and practice, and leadership in geriatric nursing education in the Pan American Health Organization region. She's a recipient of 2 Fulbright Awards. She established the World Health Organization Collaborating Center in Geriatric Nursing Education at the Rory Myers College of Nursing in NYU in 2004. She's the founding editor of the Journal of Addiction Nursing and has received funding for 5 curriculum and faculty development projects. As a member of Nursing, an interprofessional organization, she has written and advocated for substance use policies, the specialty of addiction nursing, and policies on impaired nursing practice. In addition to her title at the Meyer College of Nursing, she's a psychotherapist in private practice in New York City and consults globally on mental health issues. Once again, Madeline, so grateful to have you here as well. Our next panelist is Deborah Kavula. Ms. Kavula is a registered nurse and Eastern Regional Coordinator for the statewide Peer Assistance Program, SPAN, in New York State. She's an advocate for nurses personally impacted by the disease of addiction and supports their personal as well as professional recovery. Ms. Kavula assists nurses in navigating the complexities of licensure, legal consequences, treatment, and employment-related issues while duly protecting public safety interests. Through her compassionate approach, she helps nurses improve their professional practice management through the integration of recovery planning, prioritizing self-care, and establishing a peer network. And Deborah was instrumental in helping to create this webinar series, so we're really grateful to have her here as well. And our last panelist is Kristen Waite-Labbitt. Kristen has been a registered nurse since 1991. After losing much to alcohol and drug addiction, she turned her life around. She now works as a behavioral health nurse, has published a book about her story of recovery called An Unlikely Addict. She writes a blog on issues surrounding addiction and works with others who struggle with addiction by providing recovery coaching for nurses. She accomplishes this by presenting to nursing students at colleges and universities around the country, by speaking at nursing conferences, and by being an active participant in the International Nurse Society on Addictions, including serving as the president of the Eastern Wisconsin chapter. So once again, thank you, Kristen, for being here today as well. Welcome, ladies. Good morning, good afternoon, several of you on the East Coast. So it's exhausting reading all of your bios, such accomplished people over here. I need to take a breath. So grateful to have all of you here today. Really excited. The participation for this webinar is outstanding. So obviously there's a thirst for knowledge and information on this topic, and I can't think of a better group of leaders to help launch this webinar. So I thought I'd start this webinar with you, Kristen. We met a little under a year ago, and I was so incredibly moved by your personal story with addiction and how inspiring your recovery has been. So maybe you can tell us a little bit about your journey.
Sure. Thank you, Stephen. And thank you, everyone, for joining this webinar and just being willing to start this conversation because it's so important. So this May will be 30 years since I graduated from nursing school, which seems absolutely incredible to me that it's been that long, but there was never anything else that I wanted to do, always nursing from when I was very young. But 16 years ago, I lost nearly everything to drug addiction. I was caught diverting drugs from the hospital that I worked for. I was fired. I lost my nursing license, and I ended up spending about 4 months in jail. It all started with a prescription for Percocet after a surgical procedure in 1997. And I found myself, life was stressful. And I found myself looking for those pills to make me feel better, because they did, at least for a little while, make me feel better. And even after the surgical pain was gone, I sought out more pills and was always able to get them. I would go to my doctor and tell her I had back pain, or I had twisted my ankle. My husband, who was a carpenter, ex-husband now, but they hurt themselves at work sometimes. So he'd go to the emergency room, he'd get pills, and I would take his. So I was always looking for them. Then one day in somewhere around the year 2000, when I was working in an emergency room, it occurred to me that we throw away a lot of really good drugs. It wasn't necessarily a conscious thought, but I started taking them. I put it in my pocket and I took it home, and I took that IV medication when I got home. Most of my diversion was wasted medications, but my use escalated. And in 2003, or around that year, when I was going through a divorce, I also tried fentanyl. I had gotten I was going to be wasting fentanyl, and instead I took it home. Once I took that fentanyl, I could no longer stop using. Before that, if I didn't get any wasted drugs at work, I was okay. I went home. I wasn't happy about it, but after taking that fentanyl, I could no longer say no. I could no longer stop. I always had to have something when I was at work. I only worked 2 shifts a week, 2 12-hour shifts a week, but every time I was there, I needed to have something, needed to get something. And so it was then that I started stealing from the stock. After I did that, it didn't take them too long to figure out that it was me. And after I was caught, of course, I was fired and charged with 26 felonies, and life as I knew it was completely different. I've been sober since my time in jail 16 years ago, but my return to nursing practice was very difficult. And I didn't know how to go about getting my license back, or really even if I could. I was then, and I still am, an excellent nurse. I excelled in my practice. My peers looked to me as a resource and a role model. I had exemplary evaluations every year. There was no hint that anything was wrong, but it still happened to me. And I'm certainly not the only nurse that this has happened to, right? So it can happen to anyone, any nurse, and there's no mold that we fit into. It happens to all different levels of nurses, working in all different types of practice environments. Experts say that about 20% of nurses suffer from some form of substance use disorder. And many experts also agree that this pandemic has only made that worse. How much worse, we don't know yet. But we expect to have some kind of a surge or a increase in nurses suffering. All of a sudden, nurses who had a difficult job to begin with find themselves in a job that is even more demanding, more emotionally stressful, overwhelming, and that makes them vulnerable. And those are the nurses that need help. They need help to get through that, and they need to know where to find that help. So when I was diverting, I wanted to stop so badly. It was not a good feeling. I was not happy about it. And I didn't know where to go. I didn't know what to do or how to even think about stopping. I was very fearful about saying anything to anybody, my family, my friends at work, my personal friends. I did not know that there was a confidential monitoring program, that if I joined that, it would have helped me deal with my addiction and keep my nursing license and help me to practice safely. Because of course, that's what we want, is to practice safely, be what we need to be for our patients. But I didn't know such a program existed. And many nurses today still don't know that such programs exist. I'd like to change that. Monitoring programs can be confidential or public. So if a nurse with a substance use problem is brave enough to report themselves and ask for help, they can join the program confidentially, and it won't be visible to those people looking up their nursing license, like when they're doing job seeking. They can get the help they need and practice safely. For those like me that had legal trouble, there is a similar program, but it's all public record. So I would go through the same steps as they did, but everybody can see all the different steps that I took. See all that I went through, see all my transitions. So again, when going for a job, it becomes very difficult for someone even to call you for an interview when they see that. But once I did find the program and started it through the Wisconsin Board of Nursing, which is where I practice, I really struggled and wondered how I would ever make it through the program. I didn't have any guidance or support, no one to kind of show me the way. I knew the rules, I followed the rules, I can read and I can do that, but there was no peer assistance and no one to guide me through or help me to know what steps to take next. And many nurses I knew at the time quit the program because number one, it's very expensive and they couldn't afford it. And number two, they couldn't manage all of the strict rules, which not that they minded the rules, it was not compatible with work life or single mother kind of life. It can be very difficult. I was granted a restricted license when I joined that program, and I was able to work again as a nurse, which was so great. And I was so happy and grateful for that. But there was just so much that I didn't know. I certainly didn't know what to expect. I was often fearful that I would do something wrong, make a misstep, and then I would lose everything again. And so I completed that program in 2010, and I've had my full licensure back since then. But there are just so many things I would change about that experience and things that I hope people going through those programs today get to experience. So Deborah, I know, is going to talk about her state's program of peer assistance, a program I wish I would have had access to all those years ago. And then later on today, I'll talk a little bit about some of the things that I can do now today to help those nurses who are struggling, help make that overwhelming process a little bit easier to manage.
Thank you, Kristen. What a miracle you are. And for those listening right now, you just think about the power of recovery and what people in recovery can accomplish in their life. So thank you for sharing that. Deborah, in one of our earliest conversations, you made a comment that you just didn't want to go to any more funerals. And you had personally known a bunch of nurses that had died from alcohol and drugs. And I was so moved by the conviction in your voice to want to make a difference in this area. Can you tell us a little bit about the work you do at SPAN and why SPAN is so critically needed in this moment in time?
Yes, and thank you, Stephen. I also want to say thank you to all of you for being here. The work that I do with the SPAN program is really focused on peer support. That exact service that Kristen is talking about, that she felt didn't exist for her at that time. We're so lucky in New York State that we have a legislated program that is funded through our licensing fees so that it's essentially free when the service is needed, that provides peer support and guidance around recovery, for nurses in New York State and at any level. It could be nurse anesthetist, nurse practitioner, RNs, LPNs. And so, in my work in the peer support program here in New York, and as I've done this work in the last 8 years, have just noticed that we are very lucky to have this service, and it doesn't exist in the same ways, across the country. But there is a growing, amount of peer support available. And I thought it was so important to talk about that and kind of raise some awareness about the availability of peer support, regardless of what it looks like for you in your state. Because of what's going on with COVID, kind of just compounding the already known stress that nurses are facing in regards to their own role strain in their practice and additional role strain through the pandemic. We really do anticipate a surge in another wave of mental health needs for the nurses, coming out on the other side of this pandemic. And I really thought that it was important to have this conversation, kind of elevate this conversation to prepare for that need and to make sure that there is no nurse, it's a lofty goal, But I would really like to someday soon be able to say that there is no nurse, not only in New York State, but across this country, that is not aware of the availability of peer support services and how to access those services in a way that is helpful and useful to them or to their organization, right? And so I'm really happy to be here today. Through COVID, our program has moved, like many programs, to the telehealth platform where we've moved completely online. Our program is maybe in some ways more accessible because of that online platform. But what we continue to see, and what I continue to see in my practice, is that a little over 90% of the clients that I'm working with still are coming to our service because of an external, some kind of catastrophic event. And so what I've been doing through COVID, and what we've all been trying to do through COVID, is to take the opportunity to focus on awareness, really reach out and make these kinds of connections to help elevate a larger conversation around the awareness, but also a very solution-based conversation that targets earlier intervention and prevention services. And there's a lot of opportunity to kind of overlap or weave in peer support, regardless of what it looks like in your state, to get at better prevention and intervention opportunities. Sorry. But that's what brings me here today. And I'm very excited to be here. I welcome any questions, and I think also, welcome any connections through this conversation. One of the things that was important to me today was to really give a message of invitation that, please connect with us, either myself or any of us today, so that we can kind of work collectively to elevate not only the conversation, but some efforts towards solution for this and better prevention. We see nurses suffering. They often suffer in silence and are afraid to come forward for help because of fear around the license. And it's going to take all of us as a community of nurses, and I say that not just here in New York, but even on a national level, to really raise the support that's necessary for nurses to feel comfortable, coming forward and asking for help earlier. We all have an opportunity to create a culture of openness around this and to engage in activities that are inviting and not isolating. There are many, many things that we do as nurses in our day-to-day interactions, sometimes these micro interactions, sometimes the stigma of addiction comes through in these mini microaggressions, sometimes in the comments or personal beliefs that we have around addiction. We all see those things within the profession. And so today for me is really a call to action around some of these things for all of us to kind of take that personal inventory of what we can do as individuals to do better and raise awareness and engage people towards help and recovery. And on an institutional level, to look at what you are or maybe are not engaging in, and to maybe look at opportunities to enhance the ways you're integrating peer support into things that already exist within your agencies. So that's a big conversation, and I'm glad to be here today. And I just welcome any opportunity to talk about this. I did share some resources today that I wanted to make sure that every person on this call has. The resources that come down from the National Council for State Boards of Nursing, who also support a compassionate approach to this issue. There are just resources that every nurse needs to know are available. And I'm happy to go over those things to share some of the ideas that I see working, here in New York State, some creative ideas. And just, again, happy to be here.
Well, thank you so much for that, Deb, and congratulations on all the great work you're doing. Madeline, you have been a nurse leader for decades, instrumental in helping to develop programs and designing policy around substance abuse, and have done so much to help impaired nurses, as well as being a renowned psychotherapist. From your perspective, can you share with us the why substance abuse and burnout and mental health are so prevalent in the nursing community?
Thank you, Stephen, and hi, everybody. It's just great to be here. And this is such a wonderful group to be in because they really bring the two very important components about why we're in this process together, which is certainly the compassion. We need to care. We need to come from the heart about this, but we also need the cognitive strategies, the planning, the problem solving that helps people get into supportive networks and supportive systems. So, Stephen, when you say, why is it so prevalent in nursing? It's not any more prevalent in nursing than it is in any other health profession. We hear more about it because we have, I think, more visibility and there are more of us. There are 4 million nurses in this country. And if Kristen's statistic about 20%, which I think is really more accurate for mental health as opposed to substance use, but about 5% of those people have both, right? So actual diagnosed substance use disorders for the general public are probably about 8%. We think that maybe for health professionals, a little bit higher because they have access to controlled substances. And once they develop the disease of addiction, which you described very well, Kristen, when you really talked about the fact that the medication took over the brain and the reasoning process and drove you to compulsively use a drug in a way that you couldn't make that choice anymore. So when we talk about the stresses we're dealing with, we certainly want to put it in the framework of the pandemic, and it's nurses around the world. So we've lost colleagues. We've lost colleagues to suicide. We have a recent study by Davidson, which Deb's very familiar with, which indicates that nurses, male nurses particularly, have much higher rates of suicide than female nurses and others, but it's about, say, 27,000 male nurses per 100,000. But for female nurses, they are above their female norms with suicide as well. So that's a ratio of about 7 women in the population to 10 nurses who would be likely to commit suicide. That tells us something, right? That tells us, first of all, what it tells us about anyone who suicides, which is people don't believe they have a place to turn. That's the helpless and hopeless mentality. And it's about not having a place to turn. But within our hospital systems, the stresses related to COVID were there before. Hospital corporations tend to run understaffed, and that means that nurses are asked to do more. During the COVID experience, nurses could carry 5 to 8 patients in an ICU unit, where usually the nurse carries 1 to 3 in a normal running ICU. So when patient load goes up and patient acuity goes up, the nurses are on the front line. And corporations expect people to be putting in overtime. They expect not necessarily to pay hazard pay. So there is the stress of great demand, and then follows the kind of moral distress that we feel as nurses, which really grows from the fact that when there's great need and limited resources, and we know that we're not delivering care at high standards, that's extremely distressing. That's a very powerful kind of stress. Then add to that exhaustion, trying to manage families and personal life and not infecting friends. Those have all been exaggerated in the pandemic. But I would say that prior to that, the stresses of staffing, the issues about recognition, and I just want to make a point about this because it's so clear in what we're hearing about nursing right now. Nursing has gotten wonderful outpourings from the world about the importance of their contributions during this pandemic. That was going on before. We didn't hear about it. And the other thing we're not hearing is we're not only people with hearts, but we're very well educated and we're very good researchers. And we know something about generating nursing science and using nursing science. And I'd like us to hear a little bit more about that. So I would say one of the things that erodes the self-esteem of nurses, and the erosion of self-esteem is one of the primary reasons patients come to treatment, because the erosion of self-esteem leads to depression, negative self-talk, destructive behaviors, right? So the erosion of self-esteem is about not feeling valued. And that has been one of the primary concerns ongoing with nurses prior to the pandemic and still continues. Where's the meaning of the work, and where are nurses acknowledged more fully at decision-making tables in the society through compensation, through the kind of information sharing that I know we're going to hear more about. Thank you.
Thank you, Madeline. That was wonderful. Marie, what an honor it is to have you on this webinar. You've done so much over your lifetime to help nurses with substance abuse. So thank you so much for your service and your commitment. It's really honorable. About 6 years ago, you started the Nursing Peer Support Network in Minnesota. Can you tell us a little bit about the work they do?
6 years ago, actually 7 years ago, to be perfectly honest, it took us a year to plan it. 7 years ago, I became aware of the reality of the effect of substance use on the nursing profession. And I'm ashamed to say that I've been very close to the nursing profession my entire life. I'm one of those people who knew when I was 5 years old and a nurse colored in my coloring book in the hospital that that's what my life was going to be about. And there's never been a time when it hasn't been about nursing. So, but for the last 42 years, I have been in recovery from the disease of alcoholism, having lost a very prestigious position as Vice President of Nursing at Yale, actually Vice President of all clinical services, and having lost that position when I went into treatment for alcoholism. I still, although I was very honest about my own situation with nursing leaders, with my clients, with everybody in the company, with all my friends and relatives, I never tried to be present anywhere, not acknowledging the fact that I'm in recovery. Nevertheless, there was a disconnect between my awareness of what's going on in the nursing profession and my awareness of what part alcoholism and what effect that's having. So my work in nursing through this entire time was taking the relational reality of primary nursing, the importance of a one-to-one therapeutic relationship, from primary nursing to relationship-based care, from relationship-based care to relationship-based cultures. And finally, our latest book is on relationship-based enterprises for the corporate structure. It's always been about relationships. And yet in my own life, I've been very active in recovery. I've been very active in supporting women in recovery. I sponsor lots and lots of women in recovery. And yet I still didn't put two and two together and see what was happening in the nursing profession regarding the impact substance use disorder has on the individual nurses. An experience occurred where I was able to put two and two together. I had a magnificent experience working with the Texas Advocate Group. And I came back and I said, I really want to do something to create an opportunity for nurses to receive help from nurses in the same situation. And within 1 year of planning, we had developed the Nursing Peer Support Network. But let me say just one more thing about that preparation time. I still wasn't sure what this was all about. I knew it was about the license. I knew it was about difficulty getting a job. My own career took off in a whole different direction after I began my treatment process. And so I didn't have any of those personal experiences regarding license or professional impact. I invited all the nurses I knew in AA, all the nurses my friends knew, and we had an informational meeting at my house, and we did a check-in, and every one of them talked about the pain they experienced from isolation, being alone while they drank or used, being alone in treatment, being alone in recovery, being alone getting back into their work life. And it became so clear that the loneliness within the nursing profession was quite devastating. As time went on, I began to see that beyond the loneliness, there's the issue of stigma and shame. And that to me is one of the critical factors that we as nurses need to address. We need to recover from the legacy culture we have that says addiction is a moral failure. I want to come back to that in just a minute, but we spent about a year planning this, and I had thought it would be just casual meetings in people's homes where we would talk to each other about what was going on in our recovery life. But I had a friend who knew a lot more about this than I did, and we ended up doing a 501c3, developing a article of bylaws and articles of incorporation. And within 1 year of planning, we had our first in-person groups operating in Minneapolis and St. Paul and in one of the suburban areas. Within a year, we had 5 groups, and by the time COVID came, we had 8 groups meeting throughout the state of Minnesota in both areas of cities like Duluth and Rochester, as well as in the Twin Cities. We set it up with 2 purposes, one being education of the public and the profession, and the other being peer support networks. And quickly I learned that the issue specifically of stigma and shame that is so powerful, you can hear it in Kristen's story, you hear it in my story, it's devastating when we wake up one day and realize that as much as we've always wanted to help people, we have gotten ourselves in a position where we may not be helping, we may even be harming people. It is a devastating realization, and the stigma and shame is extremely powerful. And we learned along the way that the way to address stigma and shame is through peer support, that it can't be done through counseling, it can't be done through treatment, it can't be done through clinical interventions. It really requires the opportunity for nurses to talk to nurses. And one of the most satisfying parts about my life right now is listening to what nurses say as they're coming out of a meeting or after when they're evaluating the process. COVID came along and all 8 of our meetings stopped, of course, because they were being run in churches and other places away from treatment centers. Those places were closed down. So we turned to online and have been very surprised by the success. We were already online in a major platform that has multiple recovery group opportunities. And we brought in the Nursing Peer Support Network. It was a Tuesday, 7 o'clock a standard time meeting. And we went from about 20 people at that meeting with COVID to 80 to 90 to 100. Now that is a peer support, it says Minnesota Nursing Peer Support Meeting. And about 1/5 of the people are from Minnesota. The rest are from all over the country as well as other countries as well. We stand in a unique position that I want to explain. It's something that I think every state that hasn't been doing anything yet in this area could just do it like we did, because we didn't require any permissions from any other organizations, nor any funding from anybody else. And so we are a 501c3 nonprofit organization. We have a wonderful relationship with the State Board of Nursing. Shirley Brecken has been a friend of mine professionally for a long time. We continue to have a wonderful friendship. She's very delighted that we became this organization because they could see the desperate need for this kind of help from nurses whose license was in jeopardy. And then the monitoring program, the Alternative to Discipline program, is one that is available through the state for every licensed health professional. So we are part of that whole program. It's called HPSP, it's a hospital services program. That nursing represents 50% of all of the people in that program at any point in time, and they're covering every health professional that is licensed. And yet nursing is 50% of that total. That includes dentists and physicians and pharmacists and OTs and everybody. So we stand between those two organizations, and we have wonderful relationships with both of them. There's absolutely no conflict. In fact, it feels like we're exactly where we belong, and they are very grateful that we have taken on this work. What you said, Deborah, about the number of people who come in because of some major event, our issue in Minnesota is a number of people who come in because they're being monitored, because they have a contract with HPSP, and that requires them to come to one peer support meeting a month. And so too many of our guests, too many of our participants are here because they are being monitored. And when they finish getting monitored, many of them leave. We've worked really hard trying to educate people about the disease. We have programs. We have a wonderful website with a lot of educational programs. I've spoken at schools of nursing and hospital staff meetings the first couple of years extensively. Nevertheless, we are not getting in the nurses who are worried about their drinking. We're not getting in nurses who are doing their own recovery, who are in recovery programs or online programs, and they desperately need that support. And there's 130,000 nurses in the state of Minnesota. It means 13,000 are probably suffering from substance use disorder, and we have maybe stretching the numbers. For our 6 years, we probably had between 4,000 and 5,000 people actually avail themselves of the peer support process. So there's much work to be done. I'm going to just close by saying I wish that this profession, which I love with all my heart and soul, would take on the issue of changing our attitudes and beliefs about substance use disorder. The conspiracy of silence keeps us from sharing, kept me as a vice president from ever talking about my problems, and it contributes to the true nature of the situation. And the change I recommend is that we go deliberately from moral failure to chronic disease. The more we connect the disease of alcoholism with any chronic disease, with diabetes, it really makes the case very well. You go and you get a treatment plan, you have a treatment plan, and you're in recovery for the rest of your life, as long as you do the things that will keep you in recovery, like manage your insulin. Anyway, I feel very, very strongly that I'd love to see us shift our belief system from moral failure to chronic disease.
Well, thank you for that, Marie. That was wonderful. Kristen, I know we're sensitive with time here, so we want to make sure that we get another round in of some questions. You hear a lot about Deborah's organization and Marie's organization talking about the value of peer support. But what you're doing in addition to peer support is coaching. Can you talk a little bit about how you help nurses in early recovery with coaching?
Definitely. As a nurse coach, I work with nurses that are going through the same kinds of things that I did all those years ago. I know how it feels and how to navigate the whole ups and downs of recovery. So I can guide the nurses that are new to the monitoring programs on what to expect and suggest different avenues to explore. For instance, maybe how in the beginning you may have to find a job other than nursing until you can get your nursing license back. I looked for jobs for quite a while, all different kinds of jobs, and I ended up working in a factory for a couple of months at the very beginning. But then I was able to transition to working as a medical assistant in a doctor's office. So those were stepping stones to getting my nursing license back, not necessarily negative things, although maybe they felt a little bit like that at the time. Look, nurses are really smart, but we're not good at taking care of ourselves. We're good at taking care of our patients, but not so much at ourselves. We pride ourselves on being able to go a whole 12-hour shift without a bathroom break. That is not a good thing, not something really we should be proud of. So encouraging nurses that are in recovery, particularly new to recovery, to take care of themselves is like the highest priority. Are they getting enough sleep? Are they showering? Are they eating a well-balanced diet? Are they active instead of just sitting at home and isolating, which can be so destructive? Wellness and lifestyle coaching is a big part of it. So have they been paying their bills? Are they, following up with their dentist and doctor checkups as they're supposed to? Are they cleaning the house? Those kind of self-care things are really important. But during a crisis, those things kind of get pushed aside. So a coach helps to pull all that back into focus while also guiding them through the recovery process. As a nurse coach, I don't have all the answers, but I have been through it and I understand. The emotions that accompany, particularly early in recovery, that guilt and shame and remorse that people have talked about already, it's a roller coaster ride. And it's different for everybody, but there are similarities that make being able to talk to somebody that's been through that same kind of process so important. I understand what it all entails. I've been through it. And more importantly, I've made it through to the other side. So I can be, a role model again in this sense to show them that recovery is possible. There is hope. Because if I can do it, quite honestly, anybody can do it. So that coaching and that kind of support and offering that hope can be invaluable. It's something that I needed way back then. And it's something that I can now be for others, which is really important to me. Go ahead, Stephen.
No, that was it. Finish up. Sorry
Okay,
about that.
I was just going to say the other thing I just wanted to touch on is that telehealth idea, or a virtual treatment program for healthcare professionals in particular, like offered by Veritas. As a nurse early in recovery, it was really hard to go to public AA meetings or NA meetings because I was worried about running into a patient or a patient's family member. I was fearful of that. So having that space for just healthcare professionals really helps to ease those fears and removes that issue at all, and removes it completely. It's also helpful to be in a group of healthcare professionals that understand that environment and what it's like to work in that field and talk about not just the substance use disorder and recovery, but that too, but also what it's like to work, especially in this pandemic, what it's like to work in that kind of an environment. And it's convenient. So, nurses who do 12-hour shifts can join those meetings from anywhere at any time. They can go on a break at work if need be, and they work that out with their manager beforehand and say, hey, I need an hour to do my IOP meeting. So it's really convenient also, which is a big help for a job that is very busy. And as I think it was maybe as Madeline said, nurses are being asked to do so much more and work more hours. And so this helps to make that a little bit more manageable as well. Really, I think is a valuable option for people.
That's great. Thank you, Kristen, for that. Deb, you were so instrumental in helping to design this webinar series. You were the one that actually reached out to me and said, more needs to be done to inspire and educate leaders out there. And I notice here there's a bunch of questions on this, specifically asking, like, does SPAN have a model that they can share with other states? So, we have hundreds of nurse leaders on this webinar right now. What is the message you want to get to them? What is the call to action that you want to share with them right now?
I want to share that there are very simple and actionable things that you can implement into your organizations and for individuals into your daily practice that can make a huge difference and influence towards some of the issues that we're talking about today. And I don't know if maybe we can share, I did post some resources that we can go over. I don't know if it's possible to pull that up now. If not, we can share that, maybe somehow disseminate that to people who are interested. But there's, I feel like we have some low-hanging fruit, and that's kind of what I thought we could talk about a little bit today, and just going over. It's so important to make sure that we as individual nurses know what our resources are in the areas where we work. There's an article that was written in 2016 by my colleague who has since passed away. Her name is Becky Eisenhut. She's been instrumental with the SPAN program, and she published an article linking all of the different resources across the country. That is available to all of you attending today, and it outlines by state what the support programs are, whether they're peer support or alternative to discipline. So know what those resources are and know how they can apply to you if you ever needed them, because remember, none of us are immune to this issue. All of these issues that bring someone to a catastrophic event that is either leading them to an alternative to discipline program or a SPAN referral, these issues are deep-seated. They often begin, as far back as our childhood, right? All of us nurses, we have those high rates of adverse childhood experiences. These issues don't just begin in those catastrophic events. There's opportunity to intervene earlier. So knowing what the resources are, how and why they are important to each one of us, from a risk mitigation perspective, to know what our own potential risks are. What are the things that we bring to our professional practice that put us at risk? And why and how could this be important for me? And if not for myself, for a potential colleague? Because again, it's community around this that is going to get us away from crisis intervention to earlier intervention. So know what the resources are, know the availability of your alternative and peer support services. If they don't exist in your state, how do we be creative? Using people like Kristen as a coach, reaching out, and yes, we can share our model. We are happy to give information on that to anyone who wants it. Reaching out to people like Marie who have started these programs. We are all here and we want to talk about this. We want to do something better. There's another resource that is on this list if you want a copy of it. It's in regards to a very strong message that comes down from the National Council on State Boards of Nursing around compassionate intervention, and how do we, today is again kind of a call to action to how do we integrate a compassionate approach to all of our existing policies and procedures in our own individual practice. There's a tremendous amount of free resource through the National Council for State Boards of Nursing. They have downloadable PDF files that are posters, flyers, informationals about substance use within the profession of nursing, talking about the existence and encouraging people to get help. Are those things up in your facility? Are they visible? Are they accessible to your staff? Are you taking the time to maybe order those things and use those in your own practice? Are they available in HR? Are they available on the units? So that's a very valuable resource. They also have resources for nurse administrators and other, alternative to discipline programs in regards to best practice around the structure of those programs. So the National Council for State Boards of Nursing is a tremendous resource, and I have linked that content in this handout. Also, our statewide peer assistance for nurses, our website has similar information. Both of those sites have downloadable, usable, free educational videos outlining the incidence of substance use within the profession. Are you using those and integrating those into orientation processes, for new staff? Are you using them within your school programs for education, or inviting someone like myself or Kristen to speak with your students? Are you integrating those things? We see a good response with the orientation education that we do, and make sure that nurses know of the resource, but then also how that particular agency or health system addresses this issue. So we work to partner with facilities. So using those free educational videos is really critical. I also want to encourage considering interagency partnerships between, the alternative to discipline programs, the peer support programs, facilities, professional organizations like the National Council, those kinds of connections. There are other professional organizations like the International Health Facilities Diversion Association or the IHFDA, who are really leading and in regards to diversion prevention and detection services, they're becoming so good at teaching those tactics. And it's very helpful to identify things like diversion earlier so that we can intervene. And are we incorporating, kind of integrating peer support into the policies that exist around peer support but like diversion prevention? Are we integrating those things? So it's education, it's those interagency partnerships, and I could kind of keep going on and on. We work on a consulting basis, with facilities, with nurse administrators to make sure that policies and procedures contain written language that spells out the referral process to peer support when it comes to diversion intervention or prevention, when it comes to impaired practice protocols, things like that. So making sure that these concepts of compassionate intervention, referral to treatment, peer support, wraparound services, and follow-up. Are you considering things like preventive screening, proactive screening, like they do in regards to suicide and assessing suicide risk for nurses? Again, trying to shift away from the crisis intervention to preventive services. What can we do as a profession to kind of shift and look at opportunities right now through this pandemic to utilize enhanced EAP services? That's another form of intervention that especially administrators can influence right now. Enhanced EAP services with confidential referrals to support and treatment, making sure that those things are easily accessible. I'm seeing success with that through, some agencies are increasing the number of EAP visits that are available to nurses through COVID. Some of the unions are offering peer-to-peer support groups. I'm seeing people talk about the use of virtual lobbies to implement peer support, those kinds of things. So, there are a lot of ideas and things that we can do to kind of immediately increase access to support and address some of that low-hanging fruit that can really make a very significant difference in someone coming to support, coming to help earlier in the process. And there are other ideas. And again, this handout would be available to you guys if, or to anyone listening.
Awesome. Thank you so much for that, Deb. And we will make sure that everybody that registers for that event will get a copy of that handout. We have a few minutes left, but I really would love to hear from Marie and Madeline, your parting thoughts. I mean, we have a couple hundred nurse leaders on this call. These people look up to you, given the work, the bodies of work that you've done over your careers. What would be your call to action and any parting thoughts to people that are listening on this webinar?
So, Stephen, I want to just go back to one point that has been alluded to but not articulated. And that really is the components of comprehensive care. Nurses deserve comprehensive care. Peer assistance is part of that. Being involved in self-help programs, that works and that's supportive. Coaching is part of that. But don't forget that evidence-based treatment is part of that. And that is behavioral change in strong psychotherapeutic relationships as necessary, especially around trauma. And it also has to do with medication-assisted treatment and using medications to help people get and stay sober in their lives. And that's often left out. So we need the combination of all of those, depending on how much one can benefit from each or all of those. And I think that was one thing we just didn't mention, that comprehensive care approach.
Awesome. Thank you for reminding us about that. And Marie, your parting thoughts?
Two things I think are, one, I'm just going to say it quickly, but there's a lot more behind it. We also need to understand the difference between treatment and recovery. That treatment is at a point in time, recovery is often usually for the rest of one's life. And being clear about that, I think, is very helpful in the beginning. A lot of people think this is a disease, this is a treatment, it's all done, and it's not. The need for support groups go on into much longer period of time. And the other issue I really would love to see us take on is the conspiracy of silence. You know, Madeline, when I got that Living Legend Award, so 3 or 4 years ago, I spent 6 weeks at least debating with myself, should I say anything about being in recovery? And it was yes and no, this and that. I mean, it just was, and I've been open about it to everybody for 40 years, but to stand up in front of that group, as I did, and say, for the last 37 years of the work you're honoring me for, I was in recovery from the disease of alcoholism. And my heart was going like 60 because I knew that I was stepping over a boundary that had never been stepped over before.
But what a gift that was to all of us who have worked in this field for so many years
Yeah,
that shared that.
it
And
was,
it
it
honored
was so scary. I knew nobody could take anything away from me. I knew that. I knew I could never have a bad consequence, and still it was very difficult. So, conspiracy of silence, we need to talk. And we need to be able to talk about recovery without fear of consequences in our profession.
Oh, wonderful. Wonderful. I want to thank you all for participating. That we went a little bit over, but I absolutely feel it was well worth it. I want to thank all of you for participating. For those of you on this webinar, you'll be receiving an email with a link to this past webinar so you can watch again. You'll also have contact information of people on this webinar. There were a bunch of questions that we just didn't have time to get to. Please feel free to reach out directly to me or any one of these panelists to get the answers that you need. Also realize that this is a series, so we'll be launching additional programming throughout the course of the year around nursing and substance abuse. Thank you everyone for participating and have a great day.
Thank
Stephen,
you.
thanks for bringing us
Thanks,
together.
everybody.
Yeah,
Yeah,
thank
thanks,
you.
Stephen.